Good evening. I guess we are live. Yeah, let me just look at it. Yeah. Good evening. Today is the day 10th of daily NEET PG MCQ posting and discussion, and and that's a good sign. Like it's already day 10, and we have 24 days to go to NEET PG 2026. So the daily drill is same. We post around 20 questions in our Telegram channel. 20 MCQs comprising of image based and one video based question. So somewhere around 8 to 9 image based and one video based question, and 10 text based questions, right? uh, we don't do any advertisements for selling or anything. If you want to be part of this group, so you can just scan this QR code which is on this top in this corner, right corner, or you can also join our link. Just click on the link which is provided in the live chat, and you will be straight forward, like you will be in our group. Okay, we have around 52 members. It started as a 7-member group, now it is 52-member group for last 10 days, right? And we like we said, we don't advertise, we don't do anything. It is completely MCQ, and all the members who are part of this group, they usually attempt these MCQs, right? And at the end of the each session, like let's say yesterday was day session 9, okay, day 9, right? So at the end of the session, we will provide a document with all the questions which were posted for the day with answers and explanations. So we do the same thing today also. At 8 a.m. we start the first question. Every 30 minutes we'll post one question. Till 5:30 we will post almost all the questions. 7:30 p.m. is the last time you can give answers. So what we suggest is wait for the day. At 6 p.m. just go through all the questions, give answers, and 8 p.m. we will go to live on YouTube and start discussing. So it's we don't discuss explanations in YouTube live to save time. We mostly discuss, the correct answers, how much percentage has given a correct answer to that particular question. Okay, so without further ado, hi Amrita. Without further ado, let's start our discussion. And if you are watching this live and you have friends, you can just forward this YouTube live so that they can also watch this live. I just kept it on the live chat. Coming to the first question. So neurons, also called nerve cells, are the fundamental units of the brain and nervous system. The cells responsible for receiving sensory inputs from external world, sending motor commands to the our muscles, and transforming and relaying the electrical signals at every step in between. A single neuron receives inputs from 150 different sensory cells and what it is called as. Okay, so we have like feedback inhibition. The options are feed forward excitation, convergence, and divergence, right? 4 out of 4 options, 71% has given their answer as convergence. That's the correct answer. 29% has given their answer as feedback inhibition. Actually, these are feedback inhibition are kind of inhibiting the step using the feedback. So it can be like positive feedback or negative feedback, right? So feed forward excitation is, all the explanations will be given in the document which will be shared. So if you want to be part of this, just same thing, you just scan this Telegram QR code and be part of our Telegram channel. Coming to the next question, it's an image based question, right? We do post around 9 to 10 image based questions per day. That's our standard. So out of 20, you will get 9 to 10 image based questions, and we are expecting somewhere around 20, 40 25%, that is 45 to 50 questions as image based questions in NEET PG. If you coming to the question, 22-year-old female with hemorrhage in eyes and neck bruises. This is the image. Okay. What is the cause, right? Uh, Strangulation by ligature, hanging, throttling, and drowning. Out of which, like 11 has given answer as strangulation by ligature, and 18%, 89% has given throttling, right? So if you see, there are multiple, lesions you can find here in multiple injury marks, right? So strangulation, there should be a ligature mark. Okay, the correct answer is 89. Okay, and explanations will be shared. So coming to the next question, the loading dose of a drug is governed by primarily by what? Like what is the answer? Like what is the loading dose of the drug? How much you should give is governed by which of the following variable, right? 89% has given answer as volume of distribution, or like, and 11% has given answer as plasma half-life. The correct answer is volume of distribution. Okay, volume of the distribution decides what is the loading dose of a drug. Okay, coming to the next question, again an image based question. Just observe the image because it's a big image. It's image of, uh, it's actually image from CT, right? A low for a 40-year-old male with progressive forward bending with increasing stiffness of the spine. Okay, he has increased stiffness in lower back, hip pain, difficulty in breathing. A CT spine was performed and shown above. Okay, this is the CT. What is the most likely diagnosis? It's a 40-year-old, right? And the signs are he has a progressive pain which is forward bending with increasing stiffness of the spine. Okay, which increases stiffness of the spine. He has increased stiffness in both lower back and hip pain. Okay, and difficulty breathing also. So there are multiple things. So 33% has given their answers as rheumatoid arthritis. Okay, and 67% has given answer as ankylosing spondylitis. Okay, and the correct answer is ankylosing spondylitis. The reason for this will be explained in PDF, which will be shared to the group. So even if you are in the group and you are trying to attempt, or you don't want to attempt, at the end of the session, right, you will get a PDF. I mean, that way you can understand how many questions were answered not correctly, right? So that way you can concentrate on those topics, because that's the area where most of the people will be having some concern, right? And that's the scoring area for you. So I suggest you be part of our Telegram channel. Coming to the next question, while performing surgery on a patient who presented with clinical features suggestive of peritonitis, a diverticular perforation is seen along with fecal peritonitis. What is Hitch's stage? Hitch's stage. So what stage it is? It is asking about what stage it is. Like out of each, 87% has given answer as stage 4, 13% has given answer as stage 2. Okay, and the correct answer is stage 4. It's Hinch's stage. Fecal peritonitis is classified as stage 4. Coming to the next question, that is image based question again. Which of the following organism belongs to the given life cycle? If you see, the life cycle is like the reservoir is horse, rat, and dogs, mammals. They urinate. That will be resulting in infection of human with contamination from their urine, and obviously that leads to contamination of water bodies, and human will get infection. Then it will uh, it will do this whole cycle again. From here it will infect the mammals again, they act as reservoirs and all these things, right? The correct 90% has given answer as leptospira. That's a very good sign because it's an easy answer, right? So leptospira is the correct answer. 10% has given salmonella typhi. Okay, the correct answer is leptospira. Okay, coming to the next question, a patient who is on treatment for angina presents to you with erectile dysfunction. Okay, You decide against prescribing sildenafil because the patient is being treated with. Okay, the correct answers are 30% has given calcium channel blockers and 70% has given their answer as nitrates. The correct answer is nitrates because sildenafil will have a drug to drug interactions with nitrates. The correct answer is nitrate. Okay. Okay. Full explanations will be given if you are part of our channel. Please be part of our channel. Coming to the next question, if somebody is watching it live, please I encourage, if you are not part of our Telegram channel, just click on the link in the live chat, or you can also scan this QR code and you will become our Telegram channel member. And this Telegram channel is called Medaffin Academy. This is a part of Medaffin ecosystem. Academy is like designed to make sure that all the medical students will get um, education which is related to either competitive exams or even giving some form of webinars and all in healthcare and curriculum related webinars and all, right? So you being part of this will definitely will be somewhat beneficial, because in this platform we are not intent we want to increase our numbers so that the reach will be more. Okay. False regarding accommodative esotropia. Okay, what is a false statement, right? 0% has given it is most common type of squint. Okay, 14% has given their answer myotics are used as treatment strategy in high AC by A ratio. Okay, 86% has given correct answer it is associated with high myopia. Okay, so false statement is it is associated with high myopia. It's not the correct answer. It's actually opposite. Okay. Refractive time can be fully corrected by using of spectacles. Okay. So the false option is option C, and 86% has given correct answer. Coming to the next question again, a patient believes he is the most important person in the world, and so his neighbors and family members are trying to harm him as they are jealous of him. His wife says otherwise and says he behaves like this only recently and before he was working peacefully as a school teacher. He is mostly suffering from which of the following options. So one is delusion of grandiosity, delusion of persecution, delusion of grandiosity and persecution, delusion of grandiosity, persecution, and reference. The correct answer is actually delusion of grandiosity and persecution, right? You feel you are the important person, and at the same time you also feel that you are being targeted because of some reasons, right? And this happens in schizophrenia and mania, panic attacks, mania, and all those. The full explanation will be given, and then psychiatry is an interesting subject actually. Coming to the next question, Brown-Sequard syndrome is characterized by, okay, four options: fine touch lost on opposite side, pain and temperature lost on opposite side, pain and temperature lost on same side, only pain is lost on the same side. Okay, the correct answer 75% has kept the correct answer, and 25% has kept as a wrong answer, right? They chosen a wrong option. Pain and temperature lost on the opposite side, so contralateral side. That's the Brown-Sequard syndrome characterized by, like, one of the characteristic feature. Coming to the next question, again an image based question. A 25-year-old male patient is evaluated for primary infertility. Semen analysis shows azoospermia, right? A testicular biopsy is done and the image is shown below. The shown figure is consistent with. Um, Again, I think this is one of the tricky questions because it's an image based question, and you have to have this memory of the images also. So that's the reason we are showcasing so many image based questions, right? 13% has given answer as testicular atrophy, genital tuberculosis to 25%, and 62% has correctly answered Sertoli only syndrome. Sertoli cell only syndrome. Okay, so the correct answer is Sertoli cell only syndrome. Okay, so for full explanation, yeah, please be part of our channel. This is our channel QR code. click on it, scan it, or you can also click on our link which is I provided in the live chat. Just if you click on it, you will be part of our channel. Every day we post, those who joined now, every day we post around somewhere 20 questions, and we intend to post these questions and give also modules for NEET PG aspirants, everything for free. We don't sell anything. It is just uh, the whole initiative is conducted for NEET PG aspirants who are giving NEET PG 2026. So at the end of this live session around 10 p.m. we will be sharing the full questions, answers and their explanations in the Telegram channel. So only available in Telegram channel. Coming to the next question, a 42-year-old female was admitted with a 4 centimeter breast mass in the upper outer quadrant. Okay, biopsy was done, which revealed densely packed cells along with bland nuclei. Okay, and the mucin was found infiltrating the stroma, would which would be the most likely diagnosis. We have 22% given as papillary carcinoma, and tubular carcinoma 11%. 67% has given their answer as colloid carcinoma. Okay, and the the mucin infiltrating soma is the catch here. So the correct answer is colloid carcinoma. And so if you see, like, people are giving good correct answers most of the times. Sometimes like they are like getting confused, right? So the confused questions and the topics are very important, right? Because that's the place where you may do mistake if you are not careful enough. Coming to the next question, a researcher discovered a new drug, like community medicine, right, which is effective in chronic hypertensives with a p-value of 0.10. Which of the following is true regarding the same? So they are asking about a true statement. So when you are reading a question in exam, right, you have to be very careful whether the question is ending or have words like true, false, correct, except. So these are the magic words, or if we will miss when we are in a hurry, right? If you miss this, you may you may have the knowledge of the question, right, but you miss reading the question fully, so you may choose a wrong answer based on your knowledge. So always in these kind of competitive exams, read the question, analyze it, wait for 1 second, then give the answer. Okay, 50% has given the answer as no more than 10% of the population or people or population benefited by the drug could be due to chance. Okay, and that's the correct answer, right? So this question is also like answered wrong by 50% of the people. So what I'm trying to do is, like, I want to develop a module on community medicine only, because that's a subject which is slightly dry, but scoring, like, the number of questions are very high, right? So I am planning to do a community mission medicine sessions on YouTube, either live or as a part of segmented chapters, like to cover around like 3 to 4 hours or 5 hours of community medicine in YouTube, right? So if you feel that will help, just give a thumbs up, give a like, or just give it, yeah, that will be helpful, or yes, in the live chat, right? So that I can prepare this weekend. It means like maybe Saturday or Sunday I'll prepare that and I'll post these videos in YouTube. Coming to the next question, Medaffin, this is another image based question. It's life cycle of a virus, and they want to know, given is life cycle suggestive of which of the following viruses? There are four options again: HIV, hepatitis B, influenza, and herpes simplex virus, right? Out of which 29% has given answer as hepatitis B and 71% has given their answer as HIV. Okay, and the correct answer is actually it is uh, hepatitis B. So only 30% has given their answer, right? So so it means it's a tricky question. So this question you need to understand it properly. Okay, for full explanation we will share it in our Telegram channel. Just click on our Telegram channel link, which is provided in the chat, or you can scan this QR code be part of this Telegram channel. Okay, we we are planning to introduce so many features into the Telegram channel for the benefit of NEET PG aspirants. Coming to the next question, again an image based question. What is the name of the instrument depicted above, which is utilized for creation of pneumoperitoneum? Okay, the correct answer is where is needle. So where's needle, where is needle or where's needle? Okay, uh, 86% has given answer correctly, and the other answer given is Yanko's suction tip. Okay, that's not the correct answer. So it's like imaged and memory based question kind of. So you need to see this image based question repeatedly to understand this question. Most of the needles based questions are easy to understand and answer. Coming to the next question again, what structure is supplied by the nerve causing this elevation? Okay, if you see lateral rectus, superior oblique risorius, and levator palpebrae superioris. Sorry. So the correct answer is actually risorius. Okay, this is the thing which they are asking. Okay, so the correct answer will be explained in the full PDF which we will share. So for the sake of just showing, like, this is how the PDF will look like. Okay, so just be part of our Telegram channel, and that definitely that will help you. Coming to the next question, during administration of second dose of COVID vaccine, the nurse observed asymmetry in shoulder and the left shoulder appears flabbier. Which of the following structure is involved? Okay, the correct answer is axillary nerve is damaged during the injection, right? And the only 50% has given correct answer. So 50% has given wrong answers, right? It means this kind of question is kind of tricky, right? So yeah, keep following tricky questions, read about them, read multiple times. I think we reached almost last three questions, and this is also one more image based question. Okay, uh, a patient has an inability to flex the distal interphalangeal joints of the fourth and fifth fingers in the hand. Okay, in the hand he is unable to flex distal interphalangeal. So proximal interphalangeal, distal. So he is unable to flex distal interphalangeal flex at the distal interphalangeal joints of fourth and fifth. These are the two areas which he is unable to like flex. Okay, had he also has unable to fold a paper between the fingers, the nerve will be the most likely injured at which of the following marked regions? Okay, so it is affecting the lateral part, it is affecting the flexor group, right? So which part may be the nerve will be affected? Okay, so we have markings A, B, C and D. Okay, so four markings, right? Where it will be affected? So the correct answer is B. 70, sorry, correct answer is D. D is the correct answer, this place. Okay, so it is on the medial side, sorry, medial side, affecting the flexor. So the nerve is passing somewhere in this region. So what is that nerve? If you know the answer, just comment the nerve name in the chat or live chat. Okay, coming to the next question, nerve of the second brachial arc is, okay, we have four options again. 33% has given their answer as glossopharyngeal nerve, and 67% has given their answer as facial nerve. Okay, so the correct answer is facial nerve, right? So I guess today there is very less 100% answers. I don't know why, because every day we used to get almost 100% answers. Like, I mean, 100% has given the right answer. Today no question is 100%. Maybe today is slightly tricky day, I guess, because if you see yesterday is also like a lot of tricky questions are there, but at least majority are only one person has given wrong answer, or two persons. but at least we have like 100%. Yeah, see, you see there is 100% here, 100%, not 100% here, 100% here. So today there is no question which is 100%. Okay, that's good because we are expecting difficult cases. Coming to the next question again, then this is done. Okay, now this is a video based question. If you see, we also provide video based question. You see, it will play back again. So the baby is slightly cyanotic and he is like uh, he has a very typical presentation, right? Becoming irritable, irritated, then suddenly he become cyanotic and he stops breathing. The breathing is stopped. I'll read the question because the question will not be visible in YouTube. A 2-year-old boy with known congenital heart defects becomes severely cyanotic, tachypneic and agitated while playing. The video shows the toddler immediately dropping into a deep squatting position on the floor. Within a moment, his breathing slows and his skin color returns to baseline and baseline mild duskiness. By what exact physiological mechanism does this squatting relieve this hypercyanotic spell? Okay, so the correct answer is it increases the systemic vascular resistance, forcing more blood into pulmonary circuit. Okay, so almost everybody has given correct answer. I mean, only 3% has selected the answer. I mean, that's a thing which we are trying to observe, and maybe they are just practicing for exam. If they don't know, they're just leaving the question. Like some of the questions, almost 10 votes have been received. So we are getting good voting also, even though our numbers is less. Like people are participating in this voting, so they are just practicing. I'm assuming that the aspirants are practicing of leaving out the question if they don't know, rather than committing it and getting a negative mark. So that's a good way. So yeah, I think we completed our today's session, and the reason for this is actually the patient has tetralogy of Fallot. Okay, tetralogy of Fallot. So that's the reason why you see this kind of behavior in these children. So yeah, I mean, this is a good initiative, and we feel that our community, who is part of this Medaffin Academy Telegram channel, is benefiting from it, either in the terms of practicing when they have time, or also in the type of getting PDF materials downloaded. Okay, so if you are following our channel, just participate in this thing. Ask even your friends to be part of our channel to increase our channel size. That will encourage us because we are working harder. Like we source question, keep them in scheduler, and start posting them regularly, do everyday live sessions. So we are working hard to give a good service to people who are in our channel. If you are not part of the Telegram channel, scan this, be part of our Telegram channel, and or you can just click on the link in the live chat, that is t.me/Medaffin Academy. Okay, and being part of Medaffin Academy, you will automatically become part of a bigger channel, that is like Medaffin ecosystem. So Medaffin ecosystem is actually a startup which is backed by various healthcare professionals from various countries, not only India. So it's a global community. So you being part of it, you will become part of the every aspect we produce. So we are intending to uh, organize the biggest healthcare professional network in the world, and so be part of this. If you like our effort, please give it a thumbs up to this live YouTube stream. If you have anything which you want us to produce, like comment below, and also uh, you can also share about this live session with your friends, so that they will know about it. So liking and sharing will definitely help our channel growth, and that's a humble request from my side. So I think that's it from that's it for today. Tomorrow we will again post 20 questions. Tomorrow we will again discuss the same thing, and this will continue till the end of August 30. And after that we'll be doing another session for people who wants to do continuous learning in Medaffin Academy for either NEET PG or some other exams, right? Yeah, that's it. Thanks for listening to me. Thank you.